Do you ever use the internet to look up your illness prior to going to the doctor?
No. On occasion.
Yeah, I look online to see if there's any symptoms that match whatever I'm feeling.
If the web search you did after waking up one morning with a sore throat led you to conclude that you have Sjogren's syndrome, then you may be suffering from cyberchondria.
I decided to eat Taco Bell one day, and after 3 days of pain and not being able to sleep, I couldn't take it anymore. So, I'd kind of been trying to look up online, different things that could be wrong with me. And a lot of stuff came up, like pancreatitis, and that one I remember specifically, but there was some interesting stuff.
Thousands of people rely on the web to diagnose their symptoms or the symptoms of their loved ones prior to even stepping foot in a doctor's office.
I don't know, I guess sometimes if you get sick, it's easier to look stuff up online before you go to the doctor, just in case maybe you don't actually have to go to the doctor because it's not that bad, or maybe it's worse than you thought it was.
Many of the findings web users encounter include the rarest and absolute worst-case scenarios. But because the diagnosis fits most of the symptoms, they are convinced that they have the very worst.
I thought I was having appendicitis one time because it hurt really bad on my stomach, and it said that's where it should hurt. I just kept reading, and my anxiety levels were going through the roof because I'm reading the pain is starting on this side, and I'm at the age where I could get an appendicitis, and I was just convinced.
But beware of what you find online. Just take a look at what a search for headache comes up with. With words like meningitis, encephalitis, and cerebral aneurysms thrown at you, it's no wonder so many people consider the extreme as a possibility.
It's comforting, but it's also terrifying because you know so many more diseases and what could go wrong. If you don't get something treated, you can see how scary the results are, and there's pictures, and it's bad.
Patients have just come in and said, doctor, I went on to WebMD or something like this, and I have this problem, and I just sit there and I kind of look at them and decide, I look at their symptoms and signs and decide whether or not it is like that. But I go about it my own way before really relating it to what they are, what's going on with them, or what they have self-diagnosed. But when they do come in, I reassure them, I'm here for you. That is a possibility. It's an extreme possibility. We have to see, let's not jump to getting an MRI or a CT. Let's start off and see what your signs and symptoms are. Let's observe you. And then, we'll check out different parts of what's going on, like intraocular pressure, do an eye examination, and see if it is something like a brain tumor or whatever it may pertain to.
Dr. Kodali also had some helpful tips about what you should do when you do get sick.
If you can't see your doctor till tomorrow or till next week, and it's really not that big of a deal, go ahead and do the research, see the different aspects. There's also a lot of false information online too. So you just have to be sure you're getting the right information. And if you need to, ask your doctor, where is a good place to get information when I'm not able to contact you? In worst case scenario, if you have to, call the hospital, call the doctor. If it's an emergency, go in.
Reporting for NYU Tonight, this is Alyssa Zuckerman.